The difficulties of seeking medical treatment and high medical expenses have been the focal points of the society. Many people feel it difficult to seek medical service, from getting up early for clinic registration, waiting in line for a hospital bed, to looking for relations and friends for helping with the healthcare service. Now it's 6:45 in the morning. Most Beijing residents are probably in bed now, but here at the registration office of Beijing Tongren Hospital, people have been lining up very early to register. This scene reminds us of the time when everything was in short supply and we had to get tickets to purchase daily necessities. Why is it so difficult? Our investigation will start with clinic registration. It's too hard. I came from northeast China to Tongren Hospital to get treatment for my eyes, but after several days I still cannot get a clinic registration number. It's so difficult. Beijing Tongren Hospital is a large tertiary care hospital which is famous for its ophthalmology department. Every day, over 5,000 patients from Beijing and all over the country come here for treatment. Among them, 2,000 patients are seeking help for various eye ailments. This kind of situation is occurring all over in many other large hospitals in Beijing. This is the Peking University First Hospital. From 5 a.m. early morning every day, huge crowds of patients have been lining up to register here. With different types of doctors available, everyone wants to see an expert and may wait in line all day to register. But an expert usually only sees a total of 15 to 20 patients a week. If a patient doesn't get to see an expert, he or she may only wait until the following week. There are a lot of registration number scalpers in Tongren Hospital, Peking Union Medical College Hospital, Peking University First Hospital, Peking University Third Hospital, and many other large major hospitals in Beijing. The scalpers will have at least 20 times more income from the trade of selling registration numbers, purchasing them for little more than 10 RMB and selling them to patients for hundreds of RMB. According to a research report, the difficulties in seeing good doctors also exists in Shanghai, Guangzhou, Nanjing, and other major cities in China. According to the statistics, there were 180,000 healthcare institutions in China in 1980 and 320,000 in 2000. The number of Chinese hospitals has nearly doubled in 2 decades, but 60.7% of those interviewed thought it was much more difficult to seek medical service than before. But if you conduct interviews or investigations, you'll find most of the experts in Tongren Hospital are fully engaged or even overloaded. According to the statistics from the School of Public Health of Peking University, 70% of the primary and secondary care hospitals are suffering losses. The main problem we are facing is the bed occupancy rate of the major large hospitals. The average rate for the major hospitals can reach 110%, while it is only about 36% in small hospitals. According to the statistics, a Chinese doctor has on average 4.5 appointments per day, while many doctors in major hospitals will have to treat more than 60 patients per day. The investigations we have made show that if a patient chooses a hospital or a doctor when ill, he or she will first consider if the disease can be cured. So naturally, patients always think about where they can be cured, the major hospitals. The ordinary Chinese people crowd into the top major hospitals because human life is valued above all else. The bloody lessons of large numbers of misdiagnoses occurring in hospitals and mischarges have forced the ordinary people to go to the best hospitals for treatment, regardless of the severity of their illness. The current situation that good hospitals are absolutely dominant makes the Chinese government very cautious about opening up its medical market, because the entry of a large amount of advanced foreign hospitals will put great strain on the current Chinese healthcare system. Beijing, China U.S. International Medical Center, Harvard Medical International Associated Institution, has been the first institution of its kind to be approved by the Chinese government to enter Beijing, a great honor in itself. At the same time, the Harvard Medical International Associated Institution will bring China advanced ideas, advanced management and technology, as well as rapidly improve China's healthcare level, which will no doubt be a godsend to billions of ordinary people.